So right now we have two special guests. Gloria is going to interview the visiting nurses of the Association of Greater Lowell. So let's hand it over to Gloria.
Rachel Chaddock, who is the executive director.
Correct. Yep.
And Donna Shneider, and you are new. Your position is?
I am the Director of Business and Program Development.
Fantastic. Now, a lot of us have gone by that VNA sign on Central Street, but some of us still don't know exactly what you do. So could you tell us?
Sure. We have probably one of the best jobs or careers that anybody could have, because we get to do something that people like, and that's to stay home at home. And so as people age or as they have illnesses or become sick, it becomes difficult for sometimes for people to manage in their home environment. And we help to get people home from the hospital with services from our agency. So that might be nursing, it might be home health aid and more supportive services, it might be physical therapy or social work services. But we provide all of that to keep people so that they can function where they want to be, and that's their home environment.
Fantastic. About how many patients do you serve?
We serve about, last year alone, about 4,000 patients. At any given time, we can have anywhere from 600 to 800 patients on our daily census. The VNA of Greater Lowell has been in this community for about 104 years doing this kind of work.
Wonderful. Now, can anyone have your services? Are there certain guidelines? Or?
Most insurances will actually pay for home care services or hospice services at home. And, you know, they have different criteria, like to get acute care services, sometimes people have to be what they consider homebound, so not able to leave the home easily. For things like supportive services, if they don't have a need for nursing or physical therapy or something that the insurances would consider skilled, we also offer a service through our sister company, which is Commonwealth Nursing Services, and they have the ability to private pay for extra help for nurses' aides and housekeeping and things like that. We have a new program that we've had in place for about 2 years, and it's through a grant, and that actually allows us to keep some patients on who have chronic illnesses for the course of a full year, receiving things like telehealth services and nursing and coaching so that we can keep them out of the hospital.
Great. That's an important thing, especially now in the day
sure
of
Very
rising
important.
health prices and so forth.
Yes.
Now, you've been in business, what, over 100 years? So how has it changed over the years?
Wow, it's been 104 years that we've been around. So think back to 1909, and it was the Lowell Women's Guild, and it was mostly nursing. People were walking to make their visits. I was talking to someone the other day who actually told me when she started with the VNA, she actually did it all on foot. And she wasn't actually using, you know, a vehicle to get around. And it tended to be very focused on moms and babies at that point. And now the VNA is, especially with the hospitals, discharging people quicker and more sickly. We do a lot more complex treatments in the home that you wouldn't expect that we would be doing. So patients with ventilators can come home, and patients who need intravenous therapy. And then if you think back to medical record documentation, everything on paper, little teeny notes, a lot more regulation these days, and everything's electronic. So we use an electronic medical record. So it's really quite different than it used to be.
And with people living longer and longer, it's really become a game of trying to figure out how you're going to manage chronic illnesses. And the VNA has some real innovative programs that we've come up with to try to manage those chronic illnesses and really to keep patients out of the hospital. One of the programs that we're really excited about coming up is our mental health program that we're going to be starting. We got a special grant to start this program up, and it's going to be really geared towards seniors who have depression, anxiety surrounding their illness. And what we're finding is that when you have those types of diagnosis, it makes it very hard for them to manage these illnesses in the home. We also have our telehealth program, which is where we put a monitor in the home, and patients download their vital signs right from their home to our telehealth nurse, and we're able to intervene and try to, you know, if we see a weight gain or any kind of vital signs that don't look right, and call their doctor and try to keep them out of the hospital.
So some of these things are coming up this
Yes.
year. Are there any other changes coming up?
The other change that's coming up is we're in the process right now of working with Lowell General and some physician groups around a new congestive heart failure program. And that program will allow people who go in and out of the hospital with shortness of breath and issues related to that disease to actually get referred to us and have a symptom kit in the home, so that we have like a 4-day course of treatment that we'll give them instead of them having to go to the emergency room or being admitted. So behavioral health is coming up this year in the fall, and so is the congestive heart failure program.
Fantastic. So you are giving help to people longer and longer. I know I have a 107-year-old great aunt. So, but how can people help you? How can they support the VNA?
One of the ways that we have people who support us is they volunteer for us. We have a hospice program that actually needs people to help to support some of our patients and their families, or to help out in the office doing clerical duties. The other way is that we have many people who donate to the organization on a regular basis. We take patients on who don't have the financial means or the insurance to cover their services, and so that helps to support those services to people. And they can go online and actually look at our website, which is vnalowell.org, and it will tell you about how to make donations to the organization, as well as our volunteer opportunities.
All right. Well, I hope a lot of people will donate. I know my family has benefited from VNA services. So thank you so much for being here.